1240 and 1470. The Talk of Connecticut.
It is this time of year, the winter time. We've been talking about holidays, winter, cold, snow, all of that rolled in together. I'm so pleased to welcome to the show someone who's going to share some literally life-saving tips on dealing with the cold, talking about personal safety from our health perspective. I'm so happy to have a chance to say hello to, he's an emergency medicine physician at Bristol Hospital, Dr. Kevin Gentile. Hi, doctor.
How are you? Thanks a lot for having me on.
Well,
today.
Thank you so much for joining us. Firstly, did I pronounce your last name correctly?
Absolutely.
Gentile. Yeah. Wonderful, Dr.
Yep.
Kevin Gentile. It's so nice to talk to you. We had the chance last Tuesday, doctor, to talk to the director of your emergency medicine department, and we were talking about the importance of carbon monoxide detectors, from the fact that a lot of folks were using generators over the storm and again going into the winter time, and it was just life-saving information. Could we talk today, and I would love to ask you about some of the dangers of shoveling snow, some of the hazards associated with snow in terms of snow blowers and motor vehicle accidents, because it's that time of year, doctor.
Yeah, unfortunately, it is that time of year, and it's, something we've, can't take for granted at all in New England.
Well, and it's interesting. I grew up, where did you grow up? May I ask, doctor?
Yeah, I actually grew up in Buffalo, New York, so I am very familiar with shoveling snow.
You know a lot about snow.
Absolutely.
Well, I grew up in Connecticut, and I remember certainly when I was younger and my dad would ask me to help, and then I became a young woman, independent, and I was always shoveling my own driveway and yard and so on. But there reaches a point, I don't exactly know what that exact age is, but there reaches a point where we just need to be real mindful of that, don't we?
Yeah, absolutely. I mean, I think a lot of people get themselves into problems when it comes to shoveling because we just kind of think of it as one of those chores that must be done, but really, it really is a pretty strenuous level of activity. It puts a tremendous amount of strain on our muscles, especially our back, but also, our heart and our cardiovascular system. Just to, kind of give you an example of how much stress it puts on your body, in 10 minutes of moving snow, the average person will move about 2,000 pounds of snow. So, when you really think about that, obviously you can see the amount of strain that it puts on your body.
Now, does the snow, I'm sure it makes a difference. We have some wet, heavy snow. We have other real light, flaky snow. So does that make a difference?
Yeah, it definitely does make a difference because obviously with the wet snow, it's going to be a lot heavier. Whenever you're shoveling, if you can, it's always best to try to push the snow and not try to have to pick it up. But when it gets wet like that, it's very difficult to push it. And then when you have to pick it up and move it, it's heavy and it puts a tremendous amount of strain on your body.
And when you use the word strenuous, which it certainly is, it must make a difference also, I would think, doctor, if someone is in good shape. If someone exercises and runs and does cardio activity on a regular basis versus that proverbial couch potato, could the former shovel more snow and not be as concerned?
Yeah, it's since it is such a high level of activity, just to give you another example, shoveling snow is the equivalent of walking at a 5 miles per hour pace. So, pretty fast. So, if you're in good shape, you can definitely, do it. But if you have any type of medical problems, that's kind of when that strenuous activity will unfortunately give you some problems.
Well, you mentioned the toll on the heart. If we are out shoveling and if we feel, what kind of signs should we know to stop right away? Yeah,
obviously if you have chest pain, you'd want to stop right away. But other things would be if you started feeling lightheaded, if you started feeling short of breath, really also if you had any type of jaw, shoulder pain, that's when you'd want to stop right away and call 911 and seek medical attention.
Speaking with Dr. Kevin Gentile, he sees everything over at the emergency medicine department. He is an emergency medicine physician over at Bristol Hospital. They have a wonderful, wonderful website. Do check that out, bristolhospital.org. bristolhospital.org. I'm just laughing, doctor, thinking back about the fact that you're from Buffalo because, Buffalo is the town that everyone always laughs at in terms of snowfall. You know, that's like the benchmark. Well, it's not like it's as bad as Buffalo.
Absolutely, yeah. I mean, growing up, that was my parents always used to joke about is that's why they had us, so we could go out there and shovel for
Oh,
them.
really? Oh, smart folks. Smart folks. So if someone is shoveling, and we need to be very mindful of that. If you're not in good shape, if you're not real active, if you're maybe a little overweight, do you suggest that someone in that category just not do it?
You know, it's something that you should definitely have a discussion probably with your primary care physician, because they'll be able to look at, you know, your lifestyle and your various medical problems. But, you know, if you do get the green light from your primary care physician, you know, things that you can do to help you out is you'd want to stretch, you know, when you first started. You want to use your legs whenever possible. And you want to take your time. It's all right to take a break. And it's all right, you know, if you kind of break up the job so you can give yourself rest in between. You know, this, again, it's a chore that we often want to get done as soon as possible. But when you really realize the amount of activity that's involved in it, you definitely realize that there's nothing wrong with taking breaks.
And really pace yourself.
Absolutely.
You know, it's that common sense that doctors often share with us. As a emergency medicine physician, doctor, over at Bristol Hospital in the ER, have you seen over the years accidents involving snowblowers?
Yes, unfortunately. I mean, every time it snows outside, there'll always be some people who unfortunately injure themselves. Snowblower is one of those things that's great to have. It saves you from the strenuous activity of shoveling, but with it you have to use caution. And the biggest thing is when snow gets stuck in it, you cannot put your hand in there. Even when it's off, you should not put your hand in there. And you really should have some type of stick where you can kind of dislodge the snow using that.
I bet you have seen it all.
Absolutely. Sometimes, unfortunately, we see it all.
Yeah, oh, exactly. I'm curious, doctor, on the personal side, why was it that you chose emergency medicine as your specialty?
I just love the interactions with patients and being able to help them on their worst days.
And mentioned snowblowers. Was thinking also, doctor, about falls, you know, just in terms of and I'm very mindful of this in my house. My garage is not attached to my house. I kind of have to cross a little cul-de-sac area. And once it's slippery, and we've had a few slippery days, it really is a matter of employing that common sense and walking carefully. But if you do fall, what should we do?
I mean, like you said, usually, unfortunately, falls are probably number one injury when it's snowing outside. It's one of those things that's pretty easy to overlook. And, you know, should it be really slippery out, you just want to be mindful that you might fall. So you don't want to keep your hands in your pockets. You want them out. So should you fall, you're able to kind of break your fall and, hopefully prevent you from hitting your head or, kind of suffering a worse injury.
You know, I always think, and this is one of those things that, 10 years ago, I probably wouldn't occur to me, but with, having a cell phone, when I walk outside, I always have my cell phone in my pocket, and I always think, just in case I fall, in case something falls on me, I can call for help.
Yeah, I think that's a great idea. I mean, unfortunately, especially when it's cold outside, the last thing you want to do is fall down and not have anybody realize it and be in a position where you can't move because, unfortunately, something is broken and you can't call for help. And when there's cold temperatures, there's a risk of hypothermia. So I think that's great advice to everybody that when the weather's bad, definitely, if you have the opportunity to have a cell phone on you, go ahead and do that.
I'm curious, doctor, just in general, do you and your colleagues over at Bristol Hospital, are you busier in the ER in the winter or the summer? Is there any seasonality to it, or is it just pretty consistent?
I think it's pretty consistent. I think the type of injuries you see changes a little bit. First, in the summertime when it's nice, more people are outside, and you tend to get some more broken bones and things like that. But unfortunately, in the wintertime, infections tend to go up, and you tend to see some more of those patients.
All right, so let's, speaking with Dr. Kevin Gentile, emergency medicine physician at Bristol Hospital, let's kind of bottom line what we've been talking about, doctor, in terms of the dangers of shoveling that wet, heavy snow that Connecticut is known for. We're not Colorado that has the powdery snow. This is the East Coast that has a lot of humidity, a lot of moisture, and that makes the snow that we get wet and heavy for the most part. Could you kind of run through what you're advising folks in terms of cautioning when it comes to shoveling?
Yeah, first of all, if you do have a lot of medical problems, before you even attempt it, make sure you talk with your primary care physician to make sure it's safe for you to be able to do. And then if you are doing it, you just want to realize and kind of respect the amount of activity that's going into it. You want to, take your time, take a lot of breaks, and, should you start not feeling well at all, any type of chest pain or shortness of breath or lightheadedness, immediately stop and then seek medical attention at that time.
And for Pete's sake, keep your hands out of the snowblowers.
Absolutely. We could not repeat that enough times.
Goodness. I mean, just the thought of that. I've never witnessed it, and nor would I need to, but you, I know, have. Just the thought of it, Doctor. Oh, my goodness.
Yes, and you need your fingers, so it's obviously best to keep them intact, so just do not do it.
Yeah. Oh, my goodness. How long have you lived in Connecticut, Doctor?
I've now lived in Connecticut for 4 years.
And you think you're here for a bit?
I think so, absolutely. Family is here and loving it.
Oh, that's terrific. Oh, that's terrific. Dr. Kevin Gentile, bristolhospital.org. Would you like to share your main phone number or the main number into the emergency room, or is it just the website that we can direct folks to?
I think the website's probably easiest for everybody to remember, and the phone number will be right on that, where should they have any questions and concerns, they could obviously reference the website or give us a call.
You all do such amazing work over at Bristol Hospital. It's reflected on your website, but in terms of the different departments, the emergency medicine department as well, congratulations, Doctor. You picked a great one to work at.
Well, thanks a lot. I appreciate it, and thanks for letting me come on there and talk about these.
Oh, you're welcome. They're lucky to have you.
Thanks.
Thank you. Thank you. We'll take a break. We will be right back. Open phones when we return. If there's anything on your mind, you can talk about shoveling snow, putting hands in snow blowers. Oh, my goodness. Let's not be doing that. You can talk about Thanksgiving food. We're going to be talking with the national editor of the New York Times in the next hour about a book he wrote on that very subject. This is Mary Jones.
You're listening to The Mary Jones Show on the Talk of Connecticut. Connecticut, WDRC.